Hello, and welcome to today's RIZEcast, where we share tips for improving immunization rates from RIZE to Immunize campaign participants. Today, we'll be hearing from Nkem Akinsoto, Assistant Director, Population Health of the University of Washington Physicians. How does your team ensure patients know that they're due for a vaccination?
So, partly through my chats, through our medical record, it's able to look at the health maintenance gaps and send automated messages to patients regarding their due immunizations. And then the panel navigator team is another group that does the proactive outreach. So they constantly look at groups of patients and what might be due on their health maintenance, and they will reach out in what we call bulk messages. So you can just pull a report in a medical record that allows you to send a message, the same message to like 100 people or even 1,000 people at the same time to say, hey, we've saved you, made you your order for your immunization. Please come in anytime to get that done.
Okay, great. Do you use Epic or which EHR?
We do use Epic, yes. And that has been, I have worked very closely with our Epic team to understand the tools that are available for population health. And this is one of them. So we do those bulk messages, and sometimes we do bulk orders. So we can pull a list of the providers panel of who is due for this immunization or that immunization, and just place the orders in bulk. And the provider can also sign it in bulk, and it will be there waiting for the patients for whenever they come in.
Okay, great. And can you share more about how the University of Washington Physicians educates patients on the Tdap vaccine?
Yeah, I think there are some components that our providers have mentioned to me that patients respond well to. That is explaining that the protection lasts for 10 years. Mm-hmm. For some patients, that's not knowing that they don't have to take it for 10 years, they respond positively for that. For other patients who think, oh, I've taken it once, isn't that for life? They also, react well when they are told, oh, it was for 10 years, so now you're due for another one. The other thing is explaining and educating the patients on which diseases or things we're trying to protect them from with this vaccine. So it's a kind of a shared decision making with the patients. I think I spoke with our physician champion, Dr. Solseva, and she said for patients, just not making it seem like, oh, you just have to take this, but just explaining to them, breaking it down why they need to get it has been something that our providers have used to educate patients. They also explain what the three components of the vaccine, what makes up the vaccine. So some patients, just the first one of, oh, it's for 10 years. But there are some patients that really want to know the medical details, the clinical details, and they educate them on that as well.
Okay. Wonderful. Well, peer-to-peer learning is a hallmark of our campaign, so we appreciate you sharing these best practices that have helped you move the needle in immunization care. And we so appreciate you taking the time to be here with us today and share how you've improved immunization rates.
Thank you so much, Morgan.
Awesome.
Really appreciate the opportunity.
Thank you so much.